All right, welcome back, everyone. This is our series on intrathecal drug delivery, what patients should know. Today, we're going to talk about the trialing process. So, patients who have come to their doctor, the doctor has recommended that intrathecal drug delivery is the best next step to treat their pain. The insurance has approved this request, and you're medically stable. You've gone for your behavioral health evaluation. Now it's time to proceed with your trial. So there's two separate types of patients that I want to talk about. The first would be cancer patients, and the second would be patients either with chronic pain or spasticity. The reason why I make this distinction is, generally speaking, most doctors will skip the trial process for cancer patients. The reason for that, again, is being timing and making sure that they get the therapy a little bit more quickly because that time is of the essence. Not to say that time isn't important for chronic pain patients, but we want to make sure and do our due diligence and our testing beforehand. I've talked previously about some of the evidence around trialing. It's not a perfect predictor of whether or not the implant will be successful, but suffice it to say that most of your doctors with a lot of experience, they've made that decision that intrathecal drug delivery is right for you. And the trialing process is just the next step to undergo that implant of the device. So there are two types of trials. There is a single injection trial, and then there's a trial where you would need to go into the hospital, or some doctors very rarely will do this on the outpatient basis. So in your home setting, where they implant a catheter and connect it to a device that infuses that medicine from outside of your spine. So let's talk about the first one. The first one, the single injection, can be done either in the office, at your doctor's office, or it can be done at a surgery center. You would come in, you may or may not have an IV started for the case. If there's an IV started, usually we don't give you anything through the IV. We just make sure that if we need to give you fluids afterwards, if your blood pressure is a little bit low, that we have that option. So once you're ready to go, you'll be brought into the room. You'll be placed on the table in what's called the prone position. That's just medical terminology for placing you on your belly. The medical staff will then clean your back. The doctor will come into the room, answer any last minute questions, prepare your medications. Then they will start to take some pictures of your back. So that needle just goes in and comes right out. It's like doing an epidural steroid injection for back pain. We just go a little bit further, and the needle is a little bit different. So in all total, the time to do the injection usually is less than 5 minutes, may even be shorter than that. The doctor will use the X-ray machine to guide the needle to the appropriate place. Where that needle needs to end up, again, is in that fluid-filled space that surrounds the spinal cord. Once the doctor accesses that area, he may or she may tell you that you may feel a temporary zing down the legs. There are some nerves there, so that is possible. So, that's not a permanent damage to your nerves. That's just a little what I call tickling of the nerves. And that sensation goes away pretty quickly. The doctor then will inject a mixture of medications into your spine, usually an opioid. They may or may not add some other medications like numbing medicine. But the opioids, generally speaking, are morphine, which is FDA approved for the trials. Other possible medications would be Dilaudid, also called hydromorphone, or fentanyl. And then typically the numbing medicine would be bupivacaine. So one of the other medications that potentially could be trialed is a non-opioid and non-numbing medicine. That medicine is called ziconotide. The brand name is Prialt. Very unique medicine. That medicine is derived from a snail It's found in multiple areas across the globe, usually in some of the more tropical climates. And that snail produces what's called a conotoxin. That conotoxin is used by the snail to paralyze its prey. Um, I know that sounds very scary, but that medication has been found to provide pain relief in patients. And it is very effective. It's a non opioid therapy, but that's another potential medication that could be trialed either via the single shot technique or the catheter based technique. So those are some of the things that will inject. The needle will come out right away. There really isn't any need. It's not a surgery. Maybe a Band-Aid needs to be placed. And then the staff will bring you to the recovery room where you'll wait for a preset period of time. Everybody does this a little bit different. Um, Usually you're going to wait anywhere from 1 to 2 hours. Some doctors may make you stay even longer just to make sure that you're not experiencing any side effects. And they also want to evaluate and document that you've gotten some good pain relief. Okay. So you'll go home the same day. That medication is very fast acting, but it also wears off very fast as well. Morphine generally lasts the longest, and generally speaking, you'll have maybe about a day or so of relief, but no more than that. And then afterwards, again, the doctor will bring you back to the office and make that final assessment. So the other option is placing a catheter. Now, that can be done in the outpatient setting. I've seen that before. I don't do that myself. Most doctors will do that in the hospital setting. So similar technique, maybe a different needle to access the fluid-filled space around the spinal cord. But instead of just injecting the medicine and bringing the needle back out, your doctor will thread a catheter. Again, similar to epidurals, just like women who undergo labor, those women will get a catheter. That catheter goes into the epidural space. That's the fat space behind the spinal cord. This catheter would actually go into the fluid-filled space, again, around surrounding your spinal cord. So that catheter will get left in place. Again, everybody does this different, but when we used to do this in the hospital, we'd have patients stay anywhere from 1 to 3 days. And over time, the nursing staff will work with you to increase that medication if need be, monitor you for any side effects, and monitor you for any efficacy or benefit as well too. All that will be documented. So the disadvantage there is you have to stay in the hospital. The advantage with that particular way of doing the trial, maybe it will give you a little bit more time to assess the efficacy. But like I said, the predictive value, whether or not this is going to work or not, the evidence for that is not very good. So I wouldn't get too discouraged. We just want to make sure certainly that you get good results and no side effects. That will make the decision easier to move forward with the pump, but your doctor may make the decision, especially in cancer patients, to do that anyway. So what happens next? Then you will be brought back into the office about 7 to 10 days later. The doctor will ask you whether or not you got pain relief. And if you receive greater than 50% pain relief, you didn't experience any side effects, certainly that is an indication for moving forward with the implant. So that's the trialing process. Once you're done with that, the next step would be the implants. And we'll talk about that at our next episode or our next video. So again, I hope you enjoyed this content. Please subscribe to our channel, like this episode, and click the bell if you want to stay up to date with the latest videos that we're posting. All right, I hope everyone enjoyed this video and enjoy the rest of your day.